Hi there, I'm Dr. Claire Whitman, and I've been practicing urology here in Canada for over 20 years. Today I want to talk with you about something that affects thousands of men across the country, yet hardly anyone discusses it openly. If you're experiencing orgasm but noticing little to no semen coming out, you might be wondering what's going on with your body. Perhaps you've been avoiding intimacy with your partner because of this. Or maybe you're sitting there thinking you've somehow lost your masculinity. Let me stop you right there because that's absolutely not the case. Over my 2 decades in urology clinics from Vancouver to Toronto, I've seen countless men walk through my door with this exact concern. They whisper about it, look down at their shoes, and some have told me they've been dealing with this silently for years. Here's what I need you to understand right from the start. Dry orgasm, or what we call ejaculation in medical terms, doesn't mean you've lost your virility or that you're somehow less of a man. What it does mean is that your body is sending you a signal, and today I'm going to help you understand what to do about it immediately. Before we dive into the medical explanations, let me give you 5 practical things you can do right now, today, to start addressing this situation. These aren't complicated procedures or expensive treatments. These are immediate action steps that'll help you figure out what's happening and what your next move should be. First thing you need to do is check your urine right after orgasm. I know this sounds a bit odd, but stay with me here. Pour your urine into a clear glass and hold it up to the light. If it looks cloudy or milky, congratulations, you've just diagnosed yourself with retrograde ejaculation. This means your semen is going backwards into your bladder instead of out through your penis. It's not dangerous, and it explains why you're not seeing any fluid. Write this down and take note of it, because it's valuable information for your doctor. Second, and this is crucial, grab all your medication bottles right now. I'm talking about everything: your blood pressure meds, your prostate pills, any antidepressants, diabetes medications, everything you take regularly. Certain drugs, particularly alpha blockers like tamsulosin, that many of you take for an enlarged prostate, can absolutely cause dry ejaculation. Make a list of every single medication, including the dose and how long you've been taking it. When you see your doctor, this list is going to be incredibly helpful in figuring out if your meds are the culprit. Third action step: book a testosterone blood test. You can walk into most labs across Canada without a requisition for this, or you can ask your family doctor. Low testosterone levels can significantly reduce semen volume and eventually lead to dry orgasm. The test is simple, usually done first thing in the morning when your levels are highest, and the results will tell you if hormone deficiency is part of your problem. Don't wait on this one, because if low testosterone is your issue, treatment can make a remarkable difference, not just in your sexual function, but in your overall energy and well-being. Fourth, and I can't stress this enough, talk to your partner. I know it's uncomfortable. I know it feels embarrassing. But I've seen so many relationships suffer because men bottle this up and their partners think they're no longer attracted to them or that something's wrong with the relationship. You don't need a fancy speech. Just say something like, "Hey, I've noticed some changes with my body during intimacy, and I wanted you to know I'm looking into it with my doctor. It doesn't affect how I feel about you or how much I enjoy being close to you." That simple conversation can save you months of unnecessary distance and worry. Fifth, immediate action. Schedule an appointment with a urologist within the next 2 weeks. Not next month, not when you get around to it. Within 2 weeks. In Canada, you'll need a referral from your family doctor in most provinces, so call your GP tomorrow morning. Tell them you're experiencing an ejaculation and you need a urology referral. If you've had prostate surgery, if you're diabetic, or if this came on suddenly, make sure you mention that because it might bump up your priority. Now that you know what to do immediately, let me explain why this happens and what's actually going on inside your body. Understanding the mechanism will help you feel less anxious about it and more empowered to address it. The first thing I need to clarify, and this surprises a lot of my patients, is that an orgasm and ejaculation are 2 completely separate events. They usually happen together, which is why we think of them as one thing, but they're controlled by different parts of your nervous system. Orgasm is that peak of pleasure you feel, controlled by your brain and nerves. Ejaculation is the physical expulsion of semen, controlled by a different set of muscles and valves. You can absolutely have one without the other, and that's exactly what's happening to you. Think of it like a hockey game, eh? You can have all the excitement of watching the game, the tension, the thrill, but if the puck doesn't go in the net, there's no goal. Same idea here. The pleasure, the sensation, the climax, that's all still happening. It's just the physical release of fluid that's missing or reduced. The most common cause I see in my practice is retrograde ejaculation. Imagine there's a little valve at the neck of your bladder. During normal ejaculation, this valve closes tight, forcing the semen to go out through your penis. But if that valve doesn't close properly, the semen takes the path of least resistance and flows backwards into your bladder. You still feel the orgasm, but nothing comes out. What causes this valve to malfunction? Well, the biggest culprit is prostate surgery. If you've had a TURP, that's transurethral resection of the prostate, or any laser procedure for an enlarged prostate, there's a very good chance your surgeon altered the mechanics of that valve. They probably mentioned this might happen before your surgery, though I know many men either don't remember or weren't told clearly enough. It's not the surgeon's fault. It's just an unavoidable consequence of removing prostate tissue near that area. Medications are the second major cause, particularly those alpha blockers I mentioned earlier. Tamsulosin, alfuzosin. These drugs relax the muscles in your prostate and bladder neck to help you pee better. But they also relax that crucial valve, allowing semen to flow backwards. I've had patients who didn't connect the dots until I asked about their medications, and suddenly it all made sense. Diabetes is another big player here, especially if your blood sugar's been poorly controlled for years. High glucose levels damage the tiny nerves that control that bladder valve. It's similar to how diabetes can cause nerve damage in your feet or hands. Same process, different location. If you're diabetic and experiencing dry orgasm, getting your blood sugar under better control won't reverse the nerve damage that's already happened, but it'll prevent further deterioration. The diagnosis is straightforward. After you orgasm, you urinate into a cup, and we examine that urine under a microscope. If we see sperm swimming around in there, bingo, retrograde ejaculation confirmed. For younger men concerned about fertility, this is actually manageable. We can retrieve those sperm from the urine and use them for assisted reproduction. For older men not concerned about having children, it's mostly a matter of understanding what's happening and knowing it's not dangerous. The second major cause is obstruction of your seminal vesicles. These are glands sitting behind your bladder that produce about 60 to 70% of your semen volume. If these get blocked, either partially or completely, your semen volume drops dramatically or disappears entirely, even though you still have orgasms. What blocks them? Chronic infections are common, especially if you've had prostatitis or urinary tract infections that weren't treated thoroughly. These infections leave scar tissue behind, narrowing the tubes that carry semen. I've also seen seminal calculi, which are basically kidney stones, but in your seminal vesicles. They're rare, but when they occur, they can completely block the flow. Some men are born with cysts in their seminal vesicles or ejaculatory ducts that don't cause problems until later in life. Then suddenly, in your 50s or 60s, these cysts grow large enough to compress the ducts, and your semen volume starts dropping. Pelvic trauma from accidents, especially motorcycle or cycling injuries, can also cause strictures in these delicate tubes. The symptoms give us clues. Some men tell me their orgasms feel incomplete or that they have deep pelvic pain during climax. Others notice their semen is thicker, reduced in amount, or has little clumps in it. Sometimes the only sign is difficulty getting your partner pregnant, which prompts the initial investigation. To diagnose this, I typically order a transrectal ultrasound. It sounds intimidating, but it's a quick procedure where we use a small ultrasound probe to look at your prostate and seminal vesicles. We can see if there's a cyst, a stone, or any structural abnormality. A semen analysis showing low volume or absent fructose, which is a sugar that comes from the seminal vesicles, also points to obstruction. Treatment depends on what we find. If it's infection-related, a course of antibiotics and anti-inflammatories often helps. If there's a stone or large cyst, we can do minimally invasive surgery to remove it or open up the blocked ducts. I had a patient, let's call him Robert, 36 years old, who came in because he and his wife couldn't conceive. His semen volume had been decreasing for 2 years. We found a cyst in one seminal vesicle, removed it with a small endoscopic procedure, and 6 months later, his wife was pregnant. Success stories like that remind me why I love this job. The third major cause is hormonal, specifically low testosterone. Testosterone is the engine that drives your entire reproductive system. It stimulates sperm production, keeps your prostate and seminal vesicles functioning, maintains your sex drive, and even helps with the muscle contractions needed for ejaculation. When your testosterone levels drop significantly, everything slows down. The first thing you might notice is reduced semen volume. It becomes thinner, more watery, and eventually there's very little of it. Alongside that, you might experience lower sex drive, weaker erections, orgasms that feel less intense, and yes, eventually dry orgasm. But it's not just sexual symptoms. Low testosterone causes fatigue, loss of muscle mass, weight gain around the middle, mood changes, and difficulty concentrating. Some of my patients describe feeling like they're running on half power all the time. Here's what's important to understand. Aging naturally reduces testosterone, but it shouldn't plummet to near zero. If you're experiencing severe symptoms, you likely have hypogonadism, which is a medical condition that deserves treatment. This can be primary, meaning your testicles aren't producing enough testosterone, or secondary, meaning your brain isn't sending the right signals to your testicles. Diagnosis requires blood work. We measure total testosterone, free testosterone, and also check LH, FSH, prolactin, and thyroid hormones to get the full picture. The test needs to be done in the morning between 7 and 10 a.m. because that's when your testosterone is naturally highest. Treatment options exist. Testosterone replacement therapy comes in gels, patches, or injections. Many men feel dramatically better within weeks, more energy, better mood, improved sex drive, and yes, often better semen production. However, and this is crucial, if you're trying to father children, testosterone replacement can actually reduce your sperm count. In those cases, we use different medications that stimulate your body's own testosterone production without shutting down sperm production. Now, I need to address something serious. While most cases of dry orgasm are benign and treatable, sometimes it's a warning sign of something more concerning. I'm not trying to scare you, but I'd be doing you a disservice if I didn't mention when you need to see a doctor immediately. If your dry orgasm appeared suddenly out of nowhere, particularly if it's accompanied by blood in your urine or semen, pelvic pain, fever, or pain during ejaculation, you need to be seen urgently. These can be signs of prostate cancer, bladder cancer, or severe infection. Prostate cancer, as it grows, can obstruct the ejaculatory ducts, causing reduced or absent semen. Advanced cases might cause painful ejaculation or blood-tinged semen. Bladder cancer affecting the bladder neck can alter the valve mechanism I described earlier. Testicular tumors, though less common, can present with infertility and reduced semen volume. Neurological diseases like multiple sclerosis, Parkinson's, spinal cord injuries, or even strokes can interrupt the nerve signals between your brain and your reproductive organs, causing dry orgasm. If you're experiencing other neurological symptoms like weakness in your legs, numbness, difficulty with balance, or changes in your bladder control beyond just urinary frequency, these need immediate medical attention. There are also autoimmune conditions and systemic diseases that can affect semen production. Sarcoidosis can form granulomas in your reproductive tract. Lupus can inflame blood vessels supplying your prostate and seminal vesicles. Scleroderma can harden and narrow internal tissues, blocking ducts. The bottom line is this. If dry orgasm is your only symptom and it's been gradual, you likely have one of the common treatable causes I've described. But if you have any red flags like sudden onset, blood, severe pain, numbness, weakness, or systemic symptoms like unexplained weight loss or persistent fever, don't wait. Get yourself to a doctor within days, not weeks. Beyond the physical aspects, I want to acknowledge the emotional toll this takes. In my 20 years of practice, I've seen how deeply this affects men's sense of self. You might feel like you've lost part of your identity, your masculinity, your worth as a partner. These feelings are completely valid and understandable. Many of my patients tell me they've avoided intimacy entirely because they're embarrassed or afraid their partner will notice. Some have convinced themselves their partner will leave them or think less of them. The shame and silence create a vicious cycle where the anxiety about the condition becomes worse than the condition itself. Here's what I want you to hear. Your worth as a man, as a partner, as a human being has absolutely nothing to do with how much semen you produce. Nothing. your ability to give and receive pleasure, to connect intimately with your partner, to be loving and present. None of that requires a certain volume of ejaculate. I've had patients in their 70s and 80s who maintain wonderful, fulfilling, intimate lives despite dry orgasm. They still have desire. They still have satisfying orgasms. They still connect deeply with their partners. Once they understood what was happening and addressed the underlying cause when possible, the emotional burden lifted. If you're in a relationship, please talk to your partner. In my experience, partners are far more understanding and supportive than men fear they'll be. What damages relationships isn't the dry orgasm itself, it's the distance and secrecy. Your partner might have noticed something's different and is worried you're no longer attracted to them. A simple, honest conversation can clear up so much unnecessary suffering for both of you. If you're struggling emotionally with this, there's no shame in talking to a counselor or therapist who specializes in sexual health. Many of my patients have found tremendous relief in therapy, learning to separate their self-worth from their physical function and developing healthier perspectives on intimacy and aging. Let me share a story that always sticks with me. I had a patient named George, 64 years old, who came in 3 years after prostate surgery. He'd been experiencing complete dry orgasm since the surgery and had essentially stopped all intimate contact with his wife. He was depressed, withdrawn, and convinced his marriage was over. After our conversation and confirming his retrograde ejaculation was permanent from the surgery, I helped him understand that his ability to feel pleasure and be intimate was intact. I encouraged him to talk to his wife. He did, and you know what she told him? She'd been devastated by the distance between them, but couldn't have cared less about the ejaculation. She just wanted her husband back. That couple rediscovered their intimacy, focusing on pleasure and connection rather than mechanics. George later told me it was the best thing that could have happened to their relationship because it forced them to communicate openly and explore what really mattered to both of them. That's the kind of outcome I hope for all of you. So where do we go from here? If you haven't already, complete those 5 immediate steps I mentioned at the beginning. Check your post-orgasm urine, list your medications, book that testosterone test, talk to your partner, schedule an appointment with a urologist. When you see your doctor, be specific about your symptoms. Tell them when this started, whether it was gradual or sudden, any medications you take, any surgeries you've had, and any other symptoms you're experiencing. The more information you provide, the faster we can diagnose and help you. Remember that in Canada, our healthcare system gives you access to specialist care. Yes, wait times can be frustrating. And yes, you might need to be persistent with your family doctor to get that referral, but the care is there and it's covered. Take advantage of it. For those of you watching from other countries, the principles I've discussed apply everywhere. Seek out a urologist, be honest about your symptoms, and don't let embarrassment prevent you from getting the care you deserve. I want to leave you with this. Dry orgasm is common, it's usually explainable, and in many cases it's treatable. Even when it's not reversible, understanding what's happening removes the fear and allows you to adapt and continue enjoying your intimate life. You haven't lost your masculinity, you haven't failed as a man, and you absolutely have not reached the end of your sexual life. This is simply your body changing, as all bodies do with time and circumstance. How you respond to that change, whether you seek help, communicate with your partner, and take care of your overall health, that's what defines your path forward. If this video has been helpful, please share it with someone who might need to hear this message. Too many men are suffering in silence with something that doesn't need to be suffered through alone. The more we talk about these issues openly, the easier it becomes for everyone. And please drop a comment below telling me which of the 5 immediate steps you're going to tackle first, or if you have specific questions about your situation. I read through comments regularly, and while I can't provide individual medical advice online, I can often point you in the right direction or address common concerns in future videos. Take care of yourselves, talk to your partners, and don't let embarrassment keep you from getting the help you deserve. You've got this, and remember, I've been helping men through this exact issue for over 20 years. You're not alone, this is manageable, and there's absolutely hope for maintaining a fulfilling intimate life regardless of what's happening with your semen volume. Thanks for watching, and I'll see you in the next video where we'll tackle another topic that too many men deal with in silence. Until then, take care, eh?